MMT, forearm pronation, pronator teres and pronator quadratus. Assist the patient to the short sitting position with the feet resting on the floor or on a stool. The arm should be at the side with the elbow flexed to 90 degrees and the forearm in supination. Sit or stand at the side or in front of the arm being tested. Passively pronate the patient's forearm from the fully supinated position. Pronate the forearm so that the palm of the hand faces the floor. You are not assessing the infield. You are determining how much range the patient is able to move the elbow in this direction so that you can appropriately assign a muscle grade. In patient-appropriate language, ask the patient to pronate the forearm from the fully supinated position. Stabilize the patient at the elbow. Please note that it is not necessary to have the patient perform the active motion twice if no substitutions are observed on the first attempt. You may apply the resistance at that point. Common substitutions include shoulder internal rotation with abduction to assist with the motion. Make sure the wrist and fingers are as relaxed as possible to avoid substitution by the wrist flexors. After correcting any substitutions, ask the patient to perform the motion as previously. Support the patient at the elbow. With your other hand, grasp the forearm on the posterior surface, just proximal to the wrist. Make sure your force is applied proximal to the wrist at the radius, so the wrist is not included in the motion of pronation. The resistance is applied here in the direction of supination. Apply the force for a 5-second count. Grade 5, normal. The patient completes full range of motion in forearm pronation and holds against strong resistance. Grade 4, good. The patient completes full range of motion in forearm pronation but breaks against strong resistance. Grade 3, fair. The patient completes full range of motion in forearm pronation but does not tolerate any resistance. If these conditions are not met, the patient must be repositioned to a gravity-eliminated position. Position the patient in short sitting with the feet resting on the floor or on a stool. The shoulder is flexed to between 45 degrees and 90 degrees, and the elbow is flexed to 90 degrees. The gravity-eliminated position of the therapist is to sit or stand at the test site of the patient, supporting the arm at the elbow by cupping your hand. Instruct the patient to pronate the forearm. Grade 2, poor. The patient completes full range of motion of forearm pronation. For Grade 1, reposition the patient as for Grade 3 and support the arm in the same manner. You must now palpate the pronator teres over the upper third of the anterior surface of the forearm on a diagonal line from the medial condyle of the humerus to the lateral border of the radius. Instruct the patient to attempt to pronate the forearm. Grade 1, trace. Palpable contractile activity with no motion. Grade 0, no palpable contraction.